The Watauga County Spotlight on Education show is brought to you by the orthodontal and pediatric offices of Drs. Mayhew, Scheffler, Kahn, and Hardaway.
Welcome to another edition of Spotlight on Education for Watauga County Schools. I'm David Fonseca, Interim Superintendent, and with us today we have Shelly, who is our lead school nurse, and Dr. Paul Holden, who is our Director of Student Services. Welcome both.
Thank you.
We're going to start with Dr. Holden real quick. We celebrated National School Nurses Week, or what would be the appropriate title of what we just celebrated?
Well, on May 7th, it was recognized nationally as National School Nurses Day, and we just went to our school board just last Monday to actually turn it into a whole month that we could celebrate the great contributions of our school nurses. Yeah, we're very lucky in Watauga County to have a great set of nurses that do a fabulous job for us.
I'm sure they celebrate school nurses in Watauga County as well, but we are in Watauga County, Dr. Holt. Shelley, tell us a little bit about you and how do you get involved with school nurses, with nursing?
Well, I actually went back to school pretty late in life, but I knew that I wanted to be in public health. So my goal was, when I got out of school, was to do as much as I could to increase my knowledge in school health. I'm a nationally certified school nurse, as are two of our other school nurses, and then our newest nurse will be taking that exam probably within the next year.
Well, I can tell you that we truly appreciate the vital work that you guys do on a daily basis. You're often the first ones to deal with, all the runny noses and crying and pains and aches and all of that. And it's very hard when you can't contact the parents right away.
It is. It's very important that we have up-to-date information so we can get a hold of parents not only when they have an acute illness and they may be contagious, but also in emergency situations where we need to get a hold of them to get them either referred to a doctor or to a hospital.
What kind of specific, maybe the most medical concerns do you see out there in our schools?
Well, we deal with a lot of health issues each year. Probably our two biggest concerns that we see arise with is obesity, childhood obesity. We work very close with our physical education teachers and get in height and weight every year. They do endurance testing, and so we can keep data and know at the end of the year if programs are helping them with weight control and then endurance, physical endurance. Then our second, probably biggest concern would be poor dental health. We have a lot of students that don't see dentists on a regular basis. This year we brought in the SMILE program through North Carolina, which they bring in a dentist, a hygienist, an x-ray technician, and a dental assistant. They set up mobile dental offices in our school, and they see students that don't have regular dentists. They file insurance, they have grants to help students that don't have the funds to see dentists and don't have insurance, or they even see kids that do have dental insurance. So that has been a great success this year.
I can't say it again. We truly appreciate the great work that we do. And I know that we don't have a school nurse for every school building.
No.
But you're certainly, we wish, just like you, that we can provide. I think that we're trying to move in that direction. And that's part of the job that Dr. Holden does in trying to, think of ways that how we expand programs and how do we collaborate with others. So one of the questions for you, Dr. Holden, is here in Watauga County Schools, how do our school nurses collaborate with other school personnel?
Well, I think we have an excellent working relationship between our nurses and our other staff members. I think specifically many of our kids have health plans, and so our school nurses are in talking with our faculty every day of the week and working through those issues, because our nurses are not actually in the schools every day of the week, so they need to make sure that other personnel can pick up and be able to follow the plan at the times that they're not there. The other thing is just if we approach it in a holistic sense, certainly we're there to educate children, but if children don't feel healthy or are not healthy for one reason or another, that's part of our challenge, is to see if we can get them in a circumstance where they can learn. And so that's one of the reasons why we do this. That's really the reason why Student Services exists, is to help support our teachers to make sure that all of the children that come into our schools are ready and can learn when they're there.
So as Director of Student Services, you oversee not only the work of our school nurses, but also social workers.
Our social workers and our school counselors and a few other drug prevention activities also.
I don't think that you can talk about students without talking about all of them interconnected or interrelated, I suppose.
Mm-hmm.
All right. Well, great job. Thank you. We do have a couple of more questions, if I may. So, what are we doing, just in as general or as in depth as you want to discuss? What are we doing to prevent and to work with parents to prevent maybe childhood obesity or maybe to encourage healthy habits?
What we do, the school nurses organize a health fair every year for grades K through 9. And in those health fairs, we do a few screenings. We do vision. We also do height and weight. We do activities that are age appropriate. So they'll get different educations like on washing hands, proper way of coughing and sneezing in our sleeve, nutrition facts. We look at how much sugar, how much fat is in different kinds of foods, healthy portion sizes. We teach 8th graders how to perform CPR. We also teach 4th graders the Heimlich maneuver, and these are things that are part of their curriculum that they need to get with the standards from North Carolina. So we teach them lots of things throughout the year. Then we also go into the classrooms as guest speakers, and we talk to students about growth and development, healthy habits for being healthy, normal changes that are going to occur as they grow older and go through like puberty. So we do lots of education.
If you are just joining us, this is Spotlight on Education for Watauga County Schools, and we're visiting today with Shelly Klutz, who is our lead school nurse, and Dr. Paul Holden, who is our Director of Student Services. If you are interested in receiving more information about what Watauga County Schools is doing to reach you and your student in the area of staying healthy and participating with our schools and our school nurses and our school programs, the information is on your screen. The main number for Watauga County Schools is 828-264-7190, and you can certainly ask for Dr. Holden if you're interested in knowing more about what the great job our school nurses are doing. We have just a couple more minutes to finish, but if we have parents that do want to get involved and participate in health fairs or in the back-to-school celebration that we have in August, what can parents do to communicate with you?
They can always email the school nurses. They can contact the school that their child is going to, and they'll let them know who their school nurse is and their email address. They can always call us, and then visit our website. Each school has its own web page, and then there's a school health section under that, and we keep up with what's going on in the schools.
Okay. Dr. Holden, we're going to finish with you. If we have entering parents or entering students with parents in grades in pre-K and K, what is your advice for those parents that may have some concerns about the health of their student or may want to make us aware of concerns that they may have for their new students or any grade level? I usually think about kindergarten and pre-K.
Well, I think one of the things that works well is the state of North Carolina requires a well health check before a student comes into kindergarten. And so usually that's an opportunity for the doctors to screen for a whole host of issues. And generally at that point in time, those issues are going to be identified and then they are communicated to us in school. What I would say to any parent is that if you're talking with any school personnel, and primarily probably your child's teacher, if you have specific health concerns beyond what you believe that we know about, it's important to kind of tell the teacher, and I think then the teacher communicates with all the members of our staff, and particularly with our school nurse, to make sure we're on the lookout for peanut allergies or any other kind of allergies or other health issues that you want to make sure that we're aware of.
I want to thank you both. We had with us today for Spotlight on Education for Watauga County Schools, Shelly Klutz, who is our lead school nurse, and Dr. Paul Holden, who is our Director of Student Services. Thank you both.
Thank you.
Thank you.
The Watauga County Spotlight on Education show is brought to you by the orthodontal and pediatric offices of Drs. Mayhew, Scheffler, Kahn, and Hardaway.